Hi, my name is Kelsey Garner, and I will be talking about rehab coverage for eating disorders. And this is my persuasive essay. Eating disorders are a rising problem amongst the population. The society's stress on being thin and a rising obesity percent causes girls to have a fear of gaining weight, even if they are already thin. It is a shocking statistic of girls with an eating disorder, and yet the insurance companies fail to recognize that number. That is why they either refuse to cover treatment or offer bare minimum of days in treatment. They say that eating disorders are psychological disorders only and can be treated by a psychiatrist. They couldn't be farther off, though. The mortality rate of girls with eating disorders is quite high. That is why we need more people to fight for these rights. 8 million girls and women in this country suffer from eating disorders, and 30 to 50% of women will go through an eating disorder in their lifetime. Eating Disorders Coalition for Research Policy and Action. Most people don't know that statistic is so high, and those numbers will keep rising if we don't try to help. Elle Girl magazine surveyed 10,000 women on eating disorders. 30% of women would rather be thin than healthy. 18 to 25% would rather be run over by a truck than fat, and 2/3 would rather be mean or stupid. This is the effect society has on the population. With the people we are always looking at and to push to be thin, there is such stress on being skinny. Times change and body image always changes with that time as well. In our day and time, being thin is the way to be. This is not a problem to take lightly. Action needs to be taken so that these statistics will change and hopefully lower drastically. The fatality rate of eating disorders is 10% above other psychological disorders. These are also many long-term effects of eating disorders. Anorexia contributes to cardiovascular diseases, anemia, skeletal damage, and electrolyte imbalance. Bulimia causes gastrointestinal complications, heart abnormalities, and stomach rupture. These are only many of the long-term effects of these disorders. Therefore, medical bills will go far past rehabilitation costs. Many anorexics die from starvation. Bulimics and anorexics have a high suicide rate. The annual mortality rate associated with eating disorders is more than 12 times higher than annual death rate due to all causes of death for females 15 to 24 years old. Because eating disorders can get out of the person's hands, a lot of the time there has to be involuntary treatment because they refuse to admit they have a problem, but very much so need the help. They also refuse it due to not being capable of affording the treatment. Treatment for eating disorders is extensive. The minimum treatment for recovery is 3 months. The cost for treatment is extraordinary. It is $30,000 for outpatient and $100,000 for inpatient. Outpatient treatment is for a person that has a job, school, or things they need to attend. It consists of meetings several times a week for a couple of hours, help groups, and doctor's appointments. This is usually for the people whose cases aren't as severe. Inpatient treatment involves 24-hour provided care at a live-in facility. Constant medical supervision is placed on these patients, but before someone can be accepted into inpatient care, they have to go through broad assessments. Both of these therapies will contain cognitive therapy, family therapy, and medication. The patient can be discharged with a medical care provider discharges them with recovery. Most eating disorder patients cannot afford this treatment even though it is much needed. On top of them not being able to pay for it, insurance companies do not even cover half of the cost. For outpatient, insurance companies only cover $10,000 of the $30,000 and $40,000 of the $100,000. Or they only offer 10 to 15 days, which is not nearly enough for treatment a patient is needed. When they only get that much treatment, they have a very high chance of relapsing when they are done. To even get any treatment at all, they have to be approved by the insurance companies, and eating disorders are rarely approved them. Many of the people die from the complications from eating disorders or commit suicide. The suicide rate for people with eating disorders is quite high. They need just as much help as any other patient with mental illnesses. Regulations at federal and state levels allow insurance providers to deny or provide only minimal coverage for eating disorder treatment. Before MHPA in 1996, insurance companies were not bound to provide any coverage for treatment of mental eating disorders. The Mental Health Parity Act was signed by President Bill Clinton to help stop the process of offering less coverage to mental illnesses than serious physical disorders. The law allows for many cost-shifting mechanisms such as adjusting limits on mental illness inpatient days, prescription drugs, outpatient visits, raising coinsurance and deductibles, and modifying the definition of medical necessity. The law took effect of January 1st, 1998 and expired on September 30th, 2001. On March 15th, 2001, Senators Pete Domenici and Paul Wellstone presented the Mental Health Equitable Treatment Act. The bill was introduced to finish the work Congress began in 1996. The act was in hopes to provide all insured Americans similar parity coverage to that in the federal employees' health benefit plan. It was a step towards ending refinement against people with severe mental illnesses. It failed to pass Congress in 2003 and again in 2005. The law has still not been passed. If this bill were to pass, it would help many young people and provide them with what needed to recover and live a normal life. More and more of society are starting to realize that eating disorders is an expanding problem amongst young people. There are now more nonprofit organizations to support and help people get treatment for eating disorders. To provide information on support groups, a student body prevention online program, and also many resources to find a treatment facility. The online program is an 8-week program combining an understanding of body image and self-esteem with self-assessment and self-improvement tools. It is interactive and has been studied at Stanford University and Washington University in St. Louis, but this program is designed to help women at risk with developing an eating disorder, low self-esteem, or poor body image. It is not meant to resolve eating disorder behaviors, just to try and help prevent it. It provides nutrition information and exercise routines, and the statistics show that women who have gone through this program have experienced substantial improvement in their body image and self-esteem. It is one of the best organizations for eating disorders out there right now. Society is willing to fight for many rights. Standing up for treatment of eating disorders should be interjected in this category. America has gained numerous rights for many causes. It is a strong country and has the willpower to gain the rights and the freedom. All it takes is time and people willing to put in the effort. There is insurance for a reason, and if people are paying a monthly bill and willing to pay a deductible, then they should receive every form of medical attention they need to be healthy and live a long life. People with eating disorders struggle just as much as people with other illnesses. They aren't willing to go on treatment at first because they deny that they have a problem. But there comes a time when most of them admit to it and are willing to take the treatment. When they are willing to get better, they should have access to the treatment they need to get better. It can be helped, and death can be prevented with people who care enough to help them fight.